Something strange just happened. I'm getting Fred. Okay. Welcome, folks. We are a couple minutes late, but we're just waiting for a few more people to connect in. Not sure what's going on with your system, Councillor Parks.
I was trying to get the virtual background to work, but it just is fuzzy, so I'll just leave it off.
Fair enough. Do we have Councillor Gordon coming in?
Can you hear me now, Rick?
And you'll just have to turn your video on.
I can hear you, Gap, but I can't see you.
Well, I can see what one, two, but I can see all of you except there's can't see Brandy.
No, Brandy won't be visible. And down at the bottom of the screen, you should be able to start your video.
At the top of the screen says start video, and then it says you cannot start your video because the host has disabled it.
Then I'll go to the clerk. Hang on a second. Debbie, can you turn him back on? There we are. And will the clerk and the CAO be joining us as a panelist, or no, just like this? Thank you. All right, are we ready to go then? Okay, with that, and apologies for being a few moments late, we will call this 27th session of council to order by Zoom. I'll start with a roll call indicating presence. I'll call out the names as they appear on my screen. That is no specific order, but we'll start with Councillor Parks.
Present, Carol Parks.
Thank you. Councillor Buderick.
Present.
Thank you. Councillor Porter.
Present.
Councillor Townend.
Present.
Thank you. Deputy Mayor Hagedorn.
Present.
And Councillor Gordon. And thank you. We also have Debbie Chapman, and the CAO and the directors are available as we need them. Right. So as we start this session, I will report to the audience that we have been in closed session starting at 6 o'clock this evening for 3 items. The first is we ratified the minutes of the December 9th closed session meeting. The second was we were informed of a proposed or pending acquisition or disposition of property, that being 11 Center Street, and we provided direction to continue the negotiations through the CAO, and a bylaw will come back once those negotiations are complete. And finally, there was an issue with regard to litigation or potential litigation regarding the Amherst Island Quarry Agreement. And I will make note at this time that Councillor Townend declared a conflict of interest on that issue and stepped out of the meeting, was not present for that. So that was our closed session. We have no open forum tonight, no public meeting. Next agenda item then is the confirmation of the agenda. Are there any additional items for the agenda this evening? Seeing none, can I get a motion to approve the agenda? Counselor Buderick, seconded by Counselor Townend. Right. Any comments? Call the question. All those in favor? Any opposed? Motion is carried. Agenda is adopted. Is there any declaration of pecuniary interest in the general nature thereof? Counselor Townend? And
Yes, I declared a conflict of interest as I am under the employ of the named individual who jointly holds the aggregate license for the aforementioned Amherst Island Quarry, referred to in the report pertaining to the relevant item number 2 in the open agenda of the 27th session of regular council, and item 6 in the closed session agenda of the same.
thank you very much. Appropriate paperwork will be filed with the clerk. Right. Anyone else have a declaration? Thank you. Seeing none, we move to item 7, the minutes of the previous meetings. We'll start with the confirmation of the minutes of the 26th regular session of council, March the 23rd. You have the minutes before you. Are there any errors or omissions noted? Seeing none, can I get a motion to approve? Councillor Parks, seconded by Deputy Mayor. Right. Comments? I'll call the question. All those in favor? Any opposed? Motion is carried. Then we go to the confirmation of the minutes of the special electronic session of council on April the 14th. Again, we have the minutes before us. Are there any errors or omissions known? Councillor Porter, please go ahead.
Yeah, I'd like to draw attention to item number 3, excuse me, resolution 2020.SP.2. I'm a little concerned with the wording of that. That was not my intent when I second that motion. And in particular, the wording, it leads one to believe that we're asking for restricting travel. And that, and perhaps Councillor Townend can maybe explain further what his intent with his motion was. But
Being that
as a seconder, I was not.
I understand the concern with regard to the minutes. I can assure you that the letter's actually already gone out, and it did specifically ask for clarity with regard to the regulation. It did not put forward a position as to what that regulation should be. So that letter has already gone. Is there a particular phrasing within the minutes that we might need to adjust?
I would like it to reflect more accurately, rather than how it reads with respect to restricting. Perhaps it should read with respect to clarifying the restrictions, if any.
Thank you. Does the clerk so note that? Thank you. Are there any other errors or omissions noted in the minutes? Then can I get a motion to approve the minutes as amended? Councillor Buderick, seconded by Councillor Porter. Any comments?
No.
I'll call the question. All those in favor? Any opposed? Motion is carried. Thank you. We now move to delegations and presentations. I do believe we have Dr. Kieran Moore on the line and a PowerPoint presentation that will be managed by our clerk. Dr. Moore, are you here and available?
I am here.
I can hear you. Thank you. Are we able to bring Dr. Moore on video? Not quite there yet. We're still learning our way through these processes, Dr. Moore, and to the audience. We are getting there. There you are. I can see you now. Welcome, Dr. Moore. And are we able to bring up the PowerPoint presentation? Debbie's fingers are flying over there. There we are. And Dr. Moore, I will turn it over to you.
Well, thank you, Mayor and Deputy Mayor and councillors, and through you, the community. I very much appreciate the opportunity to speak with you tonight and hopefully answer any questions that you may have about this rapidly changing environment we're now living in. And I do want to acknowledge the sacrifices that many in our community have made for social isolation and the economic sacrifices they've made. But I think our community is doing well from a health vantage point, that we've been able to control and limit the spread of COVID, and we must continue to do that work. We all must remain vigilant, and I have to thank everyone in the community for having been so reasonable and prudent and adhering to the new normal. With your permission, I can go over the background of COVID, some of the actions that your local public health agency has taken in partnership with you and our local hospital and L&A paramedics. And then we can discuss the new recovery plan that was just released today by the ministry and the Premier. And I'm happy to take any questions. Next slide, Deb.
Thank you.
So the background, this is a new infection. We've never seen it before. None of us have immunity to it. On average, if you're exposed to it, you start to develop symptoms around 5 to 7 days later, and you may develop a fever and or a cough and or increased difficulty breathing. There are other symptoms associated as well, such as a sore throat or laryngitis, or if you're elderly, you may have an exacerbation of your underlying diseases. So if you have heart failure, your heart failure may get worse, or if you have lung disease, your lung disease may get worse. And on average, if someone gets that infection, they are infectious roughly a day before their symptoms develop. And by around day 14, they're no longer infectious to anyone else. So that's why we ask anyone that's come in contact with someone who's diagnosed with COVID-19 to isolate themselves for 14 full days, because after that period of time, they shouldn't be infectious to anyone else. Next slide. So we, your local public health agency, practices response to pandemic. And this summer, we had brought all our paramedics, acute care partners together and had worked through how to respond to a severe influenza season, a mild season, and or a new pathogen. And a lot of that work that we had done in the summer, bringing partners together, has paid off. We've also met with all of our primary care partners in early March and prepared them and their offices how to respond to this. And then we set up our assessment centers, and we have an assessment center at Lennox and Addington Community General Hospital that's really working very well to rapidly assess patients, to test them, and to follow up with them if needed. And we're partnering with them on that work. Next slide. So most major areas of the globe have gone through severe epidemics, like in New York and or Washington State and or Northern Italy or Iran or China, where they have a sudden rise in patients. And I think that's what our community was most concerned with, our province was most concerned with, and overwhelming the health system. Well, I'm happy to say our first wave of infection peaked on around April 1st, where we had around 8 cases in one day. That was our peak. And over a total of around 50 people got infected. And those were mainly individuals that were returning from outside of Canada, and snowbirds returning or returning travelers. And luckily, through combined efforts of our healthcare providers and public health in our community, we've been able to limit the spread. And our hope is that we can just have small undulations or small waves of activity, but never a sudden wave like many countries are experiencing, or large cities in North America. Next slide. And it's taken really an entire community to respond to this. And all of these partners in our chain of protection for KFL&A have really worked hard to limit the spread of this infection, whether it's our school boards, our colleges, our long-term care facilities, retirement homes, primary care. We've worked very closely with Quinte Detention Center, with our federal corrections facilities in Bath, and also with our healthcare partners and families and communities and agencies. And it takes a community to respond and protect our community from this new pathogen. And I have to highlight the significant work that every one of these agencies and partners has done to limit the spread and the sacrifices that many have made in our community. Next slide. So we went into an incident management system, somewhat like yourselves, to respond to this, and have been meeting 3 times a week ever since, and have had to try to a social media campaign to increase awareness of this illness in our community. And we've been quite active in many domains to try to make people understand the ramifications of this infection and the necessity of adhering to social and physical distancing. Next slide. So our current dashboard, you can see it on the KFLA Public Health website. We've had a total of 59 cases in our community, 56 of which have recovered. So we only have 3 active cases in our community, one of which was a healthcare worker who worked outside of KFL&A and acquired the infection outside, but their address is here. So that's why we count individuals by their address. We've had only 6 people that needed to be hospitalized. We've had no deaths, and luckily no significant outbreaks in our long-term care facilities or our corrections facilities, which we're very concerned about the risk in those environments. So that's to date, and we're working diligently with all partners to prevent further spread in the community. But as you can see from this graph, the worst is over with around April 1st, and we're now just getting small number of cases. Often, if they've traveled within the province, they may risk bringing the infection back. But we're somewhat in a bubble in southeastern Ontario, where we have very low community spread and very good community. As you can see, multiple countries are experiencing much higher rates, or cities. So New York City, I think, is still on a trajectory to increase the number of cases. Italy is starting to flatten out, and this is what we mean by flattening out the curve, where you want slow growth over time, very little growth. And British Columbia just recently had another increase in cases. Ontario is starting to flatten out, but we still have significant activity in southwestern Ontario, Toronto, and Ottawa, but certainly in southeastern Ontario, so Leeds, Grenville, Lanark here, and Hastings, Prince Edward, we have been flat with no growth for quite a while. Next slide. Our assessment center, I have to thank LACGH Hospital. They've, Kim Morrison, Mr. Kavidak, they've done wonderful work to be able to allow patients to be assessed and then treated and to protect their hospital against any spread of COVID-19 within the hospital sector. They've had a brilliant strategy. And together we've tested 2,261 patients and have had a high testing rate for our region. And the percentage of all of our tests that were positive, we reached a peak early on in the epidemic where around 6% of our tests were positive. And now we're down to around 2% of the tests are positive. So that's a very low rate of positivity. The province on average today is around 7% positive for all tests. Next slide. And we've also worked very closely with all of our primary care partners, and we've got a great group of primary care physicians in Loyalist Township and in LNA who have helped us in early identification of cases, early testing, and also provide care in our long-term care facilities in Loyalist. Next slide. In the acute care, originally around 2 weeks ago, we had around 200 bed capacity at Kingston Health Sciences Center and around 30 ventilators that were open and ready in case we had a surge. Luckily, due to our community's efforts, we haven't had a surge in health system need. And so they're using the beds now for different purposes. We only have 68 available and 8 ventilators. And Lennox and Addington Community General Hospital at one point had 12 open beds and 2 open ventilators. But that capacity is being lost now. They're not allowing us to transfer patients back to long-term care facilities if they had to go to the hospital. And hopefully that will open up soon to allow the transfers. They wanted to give the long-term care facilities just a bit of a break given all the pressure they've been under recently. Next slide. I also have to thank, we've had great relationships with both Frontenac paramedics and LNA paramedics. And our LNA paramedics are starting to get trained in how to do the nose swab for the virus, and will be partners if we have major outbreaks in swabbing, and have been transporting patients between facilities with full personal protective equipment, and been great partners in protecting the health of the community throughout this. And next slide. Our long-term care, the 4 long-term care facilities within Lennox and Addington will be part of a new swabbing initiative. So we're going to be testing everyone who works in those facilities, as well as all patients. And we're starting in LNA, and then we're going to move to Kingston and Frontenac. And we're just been lucky. We've been inspecting these facilities with our public health inspectors and our public health nurses since early March and late February, and have been going into the facilities every week to support them, to provide education and guidance on infection prevention and control. And it seems to have worked, having that strong partnerships with all of these facilities. Next slide. So our main job with our long-term care facilities will be helping them with outbreak management. And we've been practicing with them. We've partnered with them on testing. Our long-term care facilities in KFL&A have one of the higher testing rates, even though we've not had any outbreaks. Around 20% of all patients in our long-term care facilities have already had a test. Clearly, they've been negative. And so I'm very happy with the work that they've been doing in their facilities. We have one of the highest testing rates outside of outbreaks. This slide, no, you can stick on this one. This is just to illustrate that long-term care facilities are an at-risk part of our community. Due to the nature that the individuals are there, they're often frail, they're there for a medical reason. And the cumulative number of residents that have had illness is, I think, Deb, we're just covering that number, 1533, and around 800 staff have tested positive. And sadly, on April 18th, they've also had 300 deaths in these facilities. And hence the reason we started in late February and March working to prevent infection getting into these facilities. And then I'm happy with the partnerships we've had locally. Next slide. We've also partnered with all of our institutions. So we have around 2,400 federal inmates in Kingston, Frontenac, Lennox, and Addington, which is if an infection gets into those environments, I think we've heard the news in New York and in other jurisdictions in Canada, the infection can spread quite rapidly. So we've had great partnerships to improve their prevention strategies. And we continue to consult with them both at the Quinte Detention Center as well as the federal corrections. Next slide. And we're also providing consultation on the emergency childcare centers for healthcare workers, for screening of children and staff, for case and contact management. And luckily, because we have a low incident rate in our community, these have been working quite well with no major issues to date. Next slide. And as well, our colleges and universities were good partners. Queen's and St. Lawrence College closed classes quite quickly in consultation with us, and then moved to electronic learning. And I do believe in September, they will continue with that. They won't be bringing students back to our communities, although that's an ongoing discussion. The school boards, the schools have been continued to close until May 31st. And we've also consulted with our military base in Kingston, who've been great partners as well. And we've partnered with the city of Kingston that provide, they used to have a shelter that housed around 40 people, but they were in bunk beds in one major room. We now have separate facilities for anyone that has an acute respiratory infection, individual rooms with staff that have full protective equipment, and another shelter that again has individual rooms, but is for those that don't have any respiratory infection. But we haven't had any detection of infection in that vulnerable population. And that's a resource that anyone in our area can use. Next slide. Planning ahead, the main things that are going to slow this down, since none of us have immunity, is giving immunity to someone through either an immunization and or having an effective treatment. And I'm going to be upfront, we don't have either as of yet. And there's various timelines to have a safe and effective vaccine in our hands. That's probably 18 months away because it's going to take study. We don't want to ever provide a vaccine without good knowledge of its effect profile and that it's both safe and effective. And that's going to need a good body of evidence and then a production of it to be able to be given to any individuals in our community. So until that time, we're going to have the new normal. And next slide. The ministry today, the Premier and the Ministry of Health discussed a strategy to open up the economy. They basically followed the WHO guidelines, which are these 6. So transmission's controlled, and I think transmission is controlled in our region, that public health has the capacity to follow up any positive cases day by day by day when we're operating 7 days a week on case management and contact follow-up. The health system, though, is still short on personal protective equipment. It's still short on ventilators. It's still short on medications, and those issues need to be fixed. We've worked well to minimize the risk in our vulnerable settings, which is great in terms of that chain of protection I discussed. If any businesses are to open up, they have to look at how to reduce infection. So social and physical distancing, masking, hand washing within their jurisdiction to bring their businesses back. Risk of imported cases have to be managed. So borders, the southern border with the United States will have to be maintained closed because they are going through a much higher epidemic risk than we are at present. International borders may be able to be opened up dependent on the risk of infection. And then we need our community engaged to tell us that they're okay with us going through a step, phased, slow, and reasonable approach to reopening the economy that won't lead to the unintended consequences of increased disease spread or infection in our community. Next slide. So we have written a document that we'd like to share with you to get your feedback on a phased approach to opening the economy based on local data and local surveillance. And we'd be seeking your feedback on that. But again, the major issues that I think are still limiting us are the personal protective equipment of workers. We don't have more than a week's supply for most of the garments. And our testing capacity is still getting stretched to the limit in Ontario. And we need that fixed before we can open the economy up. Next slide. So we have to continue the new normal of staying at home, hand hygiene, covering your cough. If you can't maintain a 2-meter distance from someone, you should be wearing a face mask in public, not a medical mask if you don't work in a healthcare system. We need to continue to protect our vulnerables in our community. And I have to salute our community and your leadership in our community with the declaration of emergency, that everyone's actions are making a difference. And we have to stay the course. We will get through this. We must be consistent and persistent in our approach, though, and always be vigilant, and we will get through this. And I'm happy to take questions. Sorry if I went over.
That's absolutely fine, Doctor, and I thank you very much for your presentation. I turn to council. Do you have any questions for Dr. Moore at this time?
Councillor Porter here. I do.
I'll start with Councillor Porter.
Thank you very much, Dr. Moore. Your presentation was very good and informative, and I appreciate you taking the time out to present that. Just a clarification, the number of cases in KFL&A, that is the number of cases that we know of from testing, but we don't really know how many actual cases. Is that a fair statement?
I think that's fair. We have been very aggressive with testing because we had testing available, both because Kingston Public Health Ontario has a lab and Kingston Health Sciences Center developed testing early on. We were so fortunate to have very good testing capacity. I'd say much better than any other local public health agency of our size. So we were able to test almost everybody that we were concerned about early on, even early on. So yes, we could have missed some early that we just said to isolate, but the vast majority, when they couldn't, they couldn't come to an assessment center, I would go to apartment buildings in those very early days when family physicians were a little nervous about testing to ensure that we were testing every individual. So our counts aren't bad, but we probably did miss some instances. Great question.
If I may follow up with that, I know that there was recommendations that if there were just mild symptoms that they didn't necessarily need to go to a testing center or need to attend a hospital. And that was the basis for my question, and that
I'm happy to follow up.
Go ahead, sorry.
I'm happy to follow up on that as well. You're absolutely right there. We were only allowed initially to swab those that had a fever and or a cough and or increased shortness of breath. Around 2 weeks ago, when the government's testing capacity improved, we were allowed to test for those that had minor symptoms. So as I said, the sore throat, the laryngitis, some of the runny nose, fatigue, change in smell, change in taste. So you're absolutely right. Only recently have we been able to expand it to those that had sort of atypical or minor symptoms.
Okay. And then you said in your presentation that no one has immunity to this. So are you saying that it's, if you've had it, it doesn't mean you're immune? Is that what your statement is, or is the science still out on that?
I misquoted. I should have said very few of us, except the 59 that have been confirmed test, have immunity. So of 200,000 people in KFLA, really only 59. So it's 99.9% of us don't have immunity to this virus.
Unless you've had it and just not been tested, or feel that you've had it and just not been tested. I'm just speaking from my own experiences that early in February, I had all the symptoms of something very similar, very unique, put it that way. And that was before we knew what was going on. So, and I suspect that probably I was not alone in that. But that was just a comment there.
Well, we may have in our tool chest soon a validated test called a serology test, which will be a blood test. And it will look at whether your body's been exposed in the past and whether you've generated an antibody. So you're right, that's a new tool that we may have to help those that could have been potentially infected early on, but we didn't have a test, or we weren't testing minor symptoms. So we may do what's sort of a seroprevalence study, where we ask individuals that think they had the symptoms to give a sample of blood, and we'll test to see if you've developed immunity. So the 59 people that we've absolutely confirmed they were exposed, that number may multiply if we can do the serology testing, but we have to wait till we get a reliable one and it's validated.
And when do you think that will happen? Do you have a timeline for that?
The government of Canada would be the ones that would license it, and they're looking at the sensitivity of the test and how well it would work and how reliable it is. So they're still assessing it. What they did in the United States is they let anyone use their serology tests, and we really don't know how valid or reliable they are. So there's a whole mix of science in the United States that we can't validate anymore. So we're waiting patiently to get the right tool into the right hands.
Okay, thank you.
Great questions.
Are there any other questions for Dr. Moore at this time? Councillor Townend.
Just a comment first, Dr. Moore, to thank you for your leadership in our region. I think I can certainly probably speak for my colleagues and other municipal partners how grateful we are to have you as our medical officer of health. And I think we've as you pointed out, demonstrated the importance of everybody coming together in a collaborative effort to follow public health advice to be able to do what we need to do. So on that basis, can you comment on your own personal advice the federal government is receiving from the Chief Public Health Officer and speak to the importance of a collaborative Team Canada approach to this pandemic across all levels of government and regions?
Well, that's a very good question, and thank you very much for your comments. It really is not me. We have a very good agency, and we have great collaborators, and some of the collaborators are on this call right now. We've had great partnerships throughout with our leadership in KFL&A and our councils, and we can't do it without you. So thank you as well. Absolutely has to be collaboration, coordination, and effective communication at the federal level, provincial level, local level. And without that, we won't succeed. And we had a lot of learning that was done initially about when to close borders and open borders and control travel. Those were tough decisions at the time, and they were the right decisions. Certainly, we would have loved them earlier, and a more effective quarantining at the federal level. These will be lessons learned, but we're in actually a good position relative to many other countries. I think once we evaluate our actions, we will learn, we'll be better prepared for the next time. And we must continue to work effectively together. I'm very happy that the comments that our Premier is making, working with the federal colleagues and being collaborative and communicating effectively across all barriers, all parties, and all levels of government. I mean, I'm frankly, I was surprised and pleasantly so that how effective federal, provincial, and local jurisdictions are working all together to fight this infection.
Thank you. Anyone else have a question or comment for Dr. Moore? Councillor Parks.
Thank you. Through your worship, Dr. Moore, I was just wondering about the vaccines that they're working on. Would that be specific to the COVID-19? My understanding with these coronaviruses, they jump species to species, and they are very similar in nature based on what happened with SARS. But is the vaccine that they're looking at specific to the COVID-19, or would that be kind of a general vaccination that would happen?
Great question. Thank you so much. And it would be very specific to this COVID-19 pathogen, and it would only use if you think of it as a crown with the little dots around the circle, you'd take the little dots where there's spike proteins, and that's what our body reacts to. You take those spike proteins from that particular virus and you'd mix it up with an additive agent, and that's what gets injected into the arms. So that it would be very specific. So if the virus changes or mutates, we would have to modify what spike protein we use. And it's remained relatively stable to date, even though it's a new virus. It hasn't mutated significantly as compared to influenza, which is very promiscuous and changes rapidly and shares its RNA around. So we will need one vaccine for influenza, which changes seasonally, and one for COVID going forward. And most likely this virus will eventually become one of our winter viruses that causes illness. And hopefully down the road, we can combine them into one injection, but initially they'd be separate.
Thank you, Dr. Moore. Anyone else have a question or comment for the doctor at this time? Seeing none. Again, Dr. Moore, I reiterated my comments from previously. Your team with public health has done an absolutely amazing job, and we really appreciate all the efforts that you personally and all of your team have put into this. Hopefully we keep working together and keep this curve as flat as possible, plank it, whatever term you want to use, and that we yes, we will have people that will get sick, but hopefully they'll get sick over a slow enough period that our healthcare system can manage it. So thank you very much for your efforts on this. Infection control is your specialty, and we appreciate it.
Well, thank you for the opportunity to speak with you today. It's been wonderful.
Thank you. We'll look to council for a motion to receive the presentation from Dr. Moore. Councillor Townend, seconded by Councillor Gordon. Any comments? Councillor Townend, go ahead.
Just to receive the delegation with the utmost thanks and gratitude.
And Councillor Gordon, second comment. Anyone else? I'll call the question. All those in favor? Any opposed? Motion is carried. Thank you very much, Dr. Moore.
We'll convey your thoughts to our staff. Thank you again.
Thank you. Okay, with that, I'm sure the clerk will figure out the connections for you, Dr. Moore, and we will continue on with our agenda. Thank you. That was our delegations. We looking at the agenda now. We're moving on to the Business Services Department, the Treasurer. We have a report with the departmental response to COVID-19. Is Mr. Dickey available to make comment on that?
Yes, sir. I'm
There
here.
he is. He's joined us. Thank you, Mr. Dickey, for joining us. Do you have anything to add to your report at this time, or should we just go to questions?
Nothing new to add at this time.
And Council, do we have the report before us? Do we have any questions with regards to it? Councillor Townend.
Thank you for the report, Mr. Dickey. It was mentioned in your report, but can you, for the benefit of the public listening in, explain why municipalities cannot run deficits and how this limits and impacts council's ability to provide greater financial relief to residents at this time?
Thank you. Through you, Mr. Mayor. The municipal governments are a creature of the province, so they are structured governed differently than at the federal and provincial levels. Federal and provincial governments can run deficits and fund those deficits, go out and get debt or issue bonds and fund, pay for that deficit over a period of years. Under the legislation for municipalities is under the Municipal Act. Provisions are that we must budget a balanced budget each year. And secondly, if we happen to run a deficit, even though we budget balanced, if we happen to run a deficit, whatever the amount of that deficit is, has to be funded in the next year through the operating budget. So if there is a deficit, we have to add it to next year's requirements and raise that money through taxes or some other way immediately in the next year. We're not able to fund it any other way, or to borrow money to pay for it, or to run deficits in the way that the other levels of government do.
Thank you. Are there any other questions or comments with regard to Mr. Dickey's report? Seeing none, can I get a motion to receive, please? Councillor Buderick, seconded by Councillor Townend. Comments? I'll call the question. All those in favor? Any opposed? Motion is carried. And moving to the next item. Sorry, hang on one sec. Item 11.12, 11.2, we have the miscellaneous fees and bylaw, fees and charges bylaw before us. Okay. Do we have questions with regards to that before we look for a motion? Councillor Porter, go ahead.
I'm just, the question is that most fees, as you indicated, are staying the same. However, there are some fees that are going up, and most notably, that's in the area of transit fares. Was this a scheduled increase, or was this just something that we do annually?
I believe that the increase in transit fares, Lori or Alex could speak to this, but I believe there's just to match the increases that are happening at the city level. Alex or Lori, is that true?
That would be correct.
Okay, you got your answer, Councillor Porter?
Yes, I have my answer. Thank you.
Thank you. Is there any other questions with regard to the miscellaneous fees and charges bylaw? Seeing none, can I get a motion, please? Councillor Buderick, so moved. Do I have a seconder? Councillor Townend, thank you. Councillor Buderick, any comments? None. Councillor Townend? Anyone else? Councillor Porter, go ahead.
I'm not going to support the motion the way it is written. I don't think we should be increasing the transit fares right now when people are in such dire straits. And my preference would have been to approve everything else except for that and delay that increase for a few months and see where we're at then.
Councillor Buderick, you have comment?
I do. I just would like to say to you, through you, sir, to Councillor Porter, that currently there is no charge for the bus. And in these time of needs, in this time of need, those people are being taken care of. This is just something I believe that's going forward. That's all.
And I
Follow up?
sorry, may I? And I understand that, but we don't know how long that reprieve is going to last. And when people do get back to work, and if the reprieve is not kept on, I don't think we should be slamming them with an increase right away. I think it's something that we need to do later on when we know where we're situated.
Are there other comments on this motion? Seeing none, I'll go back to the mover. Anything final? No? Then I'll call the question. All those in favor? Any opposed? Motion is carried. Thank you. Moving to 11.3, the 2020 municipal budget with public sector accounting. Again, we have a report before us from Ms. Farber. And I'm assuming the treasurer is listening. Are there any questions with regard to this report before we go forward? Seeing no questions, right? Can I get a motion, please? Councillor Townend, and do I have a seconder? Anyone? Councillor Buderick. Councillor Townend, do you have any comment? None? Councillor Buderick, do you have any comment? Anyone else? Seeing no further comments, I'll call the question. All those in favor? Any opposed? Motion is carried. Thank you. And then 11.2, the 2020 tax rates and the tax levy bylaw. Right, we have a report from Ms. Kelly. And again, the treasurer is available for questions. Are there any questions with regard to this report? Seeing none, I'll look for a motion. Councillor Porter, go ahead. And so moved?
Yep.
Thank you. Moved by Councillor Porter, seconded by Councillor Parks. And mover, do you have any comment?
No.
Thank you. Councillor Parks, anything? Anyone else? Seeing none, I'll call the question. All those in favor? 1, 2, 3, 4, 5. Motion is carried. Thank you. 11.5, schedule of capital works in progress as of December 31st. Again, we have a report from Ms. McNevin, and one of our standard reports. Do we have any questions with regard to this report? And none. And then I look for a motion for the recommendation. Councillor Townend, so moved. And do I have a seconder? Councillor Buderick. And mover, any comment? Seconder, any comment? Anyone else? Seeing none, I call the question. All those in favor? Any opposed? Motion is carried. Thank you. We move then to section 12, the Community and Customer Services Department. First up, we have Ms. McFarland available and a report with regard to that department's response to the COVID emergency. And Ms. McFarland is coming into the meeting right now. We have the report before us. Council, you have it. Do you have any questions for Ms. McFarland at this time? Councillor Townend, I'll start with you, and then Mr. Buderick.
Just first of all, thank you, Ms. McFarland, for all you're doing in your department. Can you speak to the decisions around the closure of the public washrooms on board the Frontenac 2 and just talk through, for the benefit of the public, some of the reasons for that decision so that residents can better understand the importance of why that decision was made?
Through you, Mr. Mayor. Like many other ferry services throughout Ontario, we made the difficult decision to close the public washrooms on board the ferry for the safety of the staff as well as the public. There is not a whole lot known as to how this virus is spread. It's changing daily, and the use of public washrooms and the cleaning of public washrooms is one that we're still researching and finding information about all of the time. The amount of PPE was, so the first and foremost, it was the safety of our staff and our ferry crew to ensure that we could continue to provide this essential service to allow people to travel through the ferry. Maintaining the health of that ferry crew is vital. Secondly, the amount of PPE and the type of PPE, when I say that, I mean personal protective equipment that would have to be used in order to clean the washroom, as when someone uses a public washroom, you don't know, you have to assume that they could potentially be infected. And that personal protective equipment is in high demand right now for medical frontline service workers. So utilizing that equipment for that purpose was something that was also taken into consideration. This is an evolving situation, and we are constantly looking at all of the decisions that we're making and trying to ensure the safety of the crew and the public and maintain those services. So those were some of those were the main reasons for those decisions.
Thank you. Do you have any follow-up, Councillor Townend?
No, Your Worship, but I'd be prepared to make a motion when you're looking for one.
Thank you. Are there any other questions with regard to this report from the Community and Customer Services Department? Seeing none, then I will take that motion, Councillor Townend. So moved. Oh, go ahead.
Here we go. I would motion to receive the report for information and further motion to direct staff to obtain a report from the Ministry of Transportation on the current status of the new ferry vessel, and that the aforementioned report should include detail of any and all related complications which are either expected or potentially anticipated in relation to limitations imposed by the COVID-19 pandemic. If I can get a seconder, I can explain the motion.
Thank you. And if we do get a seconder, can we get you to send that in writing to the clerk? And do I have a seconder for that motion? Oh, sorry, Councillor Porter, I do see your hand. Councillor Porter is a seconder. I will go back to the mover for comment.
Yeah, so obviously residents of Ward 1 are concerned about how the pandemic is affecting various things ferry related, which of course includes the Rankin construction project on the ferry docks, but also the arrival of the new ferry and what all the implications are around that. And in my discussions with staff, which have been incredibly helpful on the part of staff, a lot of these questions really are questions that need to be answered by the Ministry of Transportation that our staff are not yet equipped to fully respond. too. And so, I think it's important to acquire that information from the Ministry of Transportation, so we're able to communicate with our residents generally, but in particular the residents of Ward 1 about what they can expect in the coming year, as inevitably we know that COVID-19 is going to affect lots of different things in various ways.
Yes, thank you. Seconder, any comment?
Nothing. Oh.
Anyone else have comment? Seeing none, back to the mover. Do you want a final comment? No? Then I'll call the question. All those in favor? Any opposed? Motion is carried. Thank you. Next item, we'll leave Ms. McFarland there. COVID-19 bag tag exemption. We have a report from Mr. Galway, and the report is before you. Are there any questions for the director at this time?
Not at this time.
And do we have any questions from council? Seeing none. And we have a recommendation before us. And it's a one of type recommendation. There are some choices within that recommendation. So I would look to council to make a motion. Councillor Porter, go ahead.
I'll move to receive the report and adopt recommendation 1.
And just for clarity, recommendation 1, that council extends the 1 untagged bag of garbage per week exemption until the Loyalist state of emergency is lifted.
That's correct.
Thank you. Do I have a seconder for that? Councillor Buderick. Councillor Porter, would you like to speak to it?
Well, first of all, I don't think a lot of people realized that there was this relief available to them for the previous month. And I think that I got, as well as others, got feedback that they didn't know until the actual flyer went out. So that was one great thing about that flyer. And so I think in fairness to people, and as we know, a lot of people are struggling within their municipality, that we continue that for a month. But I'd also like to suggest to people that can afford it, who haven't been affected financially to the extent that some have, that you continue to put your bag tag on, just and not take advantage if you don't need to take advantage of it.
And understood, and it's a good message. Thank you, Councillor Porter. Seconder, I think it was Councillor Buderick. Go ahead.
As per conversations we've had, I had noticed in Amherstview quite a few people still putting tags out. So like I said, the message was delayed, and I agree with Penny on the whole idea of continuing this. It was my motion originally when we did this a month ago. I like it, and I'd like to keep going. And if you can afford to put it out there, that is a good idea too, Penny. Thank you.
And let's mover and seconder. Do we have any other comments from the rest of council? Councillor Gordon, go ahead. Councillor Gordon, you're on mute still. Nope, you were there. Nope.
Sorry,
You're
now?
good. Yeah.
Okay. No, the program is a good one. It keeps people indoors, it saves some money, a few less trips to the store, that type of thing. My only issue or concern was, which when we initiated it, was the communication side of it. So I've certainly run into people that were not aware of it, and actually a little annoyed, or in that, they've already put 2 or 3 tags out. And so how would we communicate this again moving forward? Is it just because if it's just on the webpage, a lot of people don't access that, but that was an issue.
I'll turn to either the director or the clerk to respond to the communications question. And I think the clerk is coming in.
Through your worship, there will be communication going out. The idea of the flyer was to also provide information to residents who are not online, other avenues that they can listen to. So the radio, newspaper, I believe we're doing. The timing to get it out to everybody is like 2 weeks delay. So the idea behind the flyer was to allow people to know that there was other. They can also phone into the township office to have that information, but we'll try and get it out as well to essential businesses that are open during this time. We're going to send it out to them to ask that they post it. So grocery stores, gas stations, businesses like that.
Thank you, Ms. Chapman. Does that answer your question, Councillor Gordon?
Yeah, I guess the places that sell the bag tags, if there was something on display at the counter, so when people came in and asked, they were aware of, gives it a little bit more visibility. Like Foodland.
Absolutely. We will be providing them with we will be providing them with that type of information and posters. It is up to them as to whether they post it or not. I can also tell you that Mr. Cornelius, our communications officer, is already working on the draft pending the decisions made this evening. So it will be expedited as quickly as possible. Are there any other questions with regard to, or comments with regard to this motion? The clerk has a question.
I was going to say the other is council members can also let people know. I mean, that you're in the public eye and people will come to you. So we're hoping that you'll share that information as well.
Thank you very much. And I'll add that with the production of the last one, I arranged for some paper copies to be available to members of council. We'll do the same with this one. And if need be, I can deliver them to your mailbox. So let me know if you want paper copies. Any other comments before I go back to the mover? Then back to mover. Any comment?
Yes, just one last comment is that I did go on the website and I did try and find where it said that there was no charge for garbage. And believe me, it was a challenge to find it. I did find it. So I'm wondering if that message could be front and center as opposed to buried in the various tabs. And that might help quite a bit, as well as the message that, you know, if you don't need to take advantage of this program, please don't. That message could go along with the message that it's free for another month or until the emergency is lifted.
Thank you. Good advice, and we'll pass that along to the communications people with regard to the website. Thank you. With that, I will call the question on the motion. All those in favor? Any opposed? Motion is carried. Thank you. Then we go to item 12.3, special events cancellations. We have a report from Ms. Cormier, and we have the director here for questions with regard to this. I'll start with, do we have any questions with regard to this report for the director? Seeing none, I'll go to the director. Oh, hang on. Councillor Townend, do you have? No? Okay, I'll go to the director. Do you have any additional comments to make?
Through you, Mr. Mayor, I just have an update that the Odessa Fair has actually been canceled. That was scheduled to happen in the middle of July. That has happened in the last week. They have gone ahead and canceled that. I also had an update with regards to a request from Lion's Heart Food Program.
Mm-hmm.
I don't know if you'd like to do that now or after we do the special events.
If you'd like to speak to that now, go ahead.
Okay. So we have been contacted by the Lion's Heart's Food Program for them to have access to our community center and our kitchen to hand out meals to the community. We've been working with them. Teresa, our manager of recreation, has been working with them to work out the details to ensure that our facility is accurately or it's set up properly for the program that they want to run. We've worked through their plans and what they are doing, and we feel comfortable that we could provide this service. What I am looking for from council for direction is if they would like to do this service, we would be looking at providing the space for them. So that would be waiving of the rental fees. And we would also be looking at disposing of any garbage and recycling. They are looking at 3 times a week doing this service, which would end up being approximately $800 a week, $822 a week that we would be waiving. And then I would also be looking for direction on the longevity of the program, how long you would like to continue to do this. I think based on these times, it might be worthwhile doing a month-to-month basis. They are suggesting, when we asked them, they said until such time that operating agencies and food providers are able to open again, and we would have to coincide with when we would be needing that facility again. But those are the 2 directions that I would like, that we would need from council to move ahead. They could be ready to start as soon as tomorrow if we were moving ahead. I think it's, if the option is to go ahead, it would be more likely Thursday that we could have everything in place for them to start the program. And they are looking at 3 days a week from 5 to 6. And we would have to do some advertising and things like that about the program, but it's really just, we need direction from council if they'd like to move ahead with this program.
Okay. Then thank you for that report. I will consider that to be 2 separate resolutions coming from council. The first one being the special events and policies with regard to that, and the second one being specific to the Lionheart project. So, council, do we have any questions? Councillor Gordon.
Hi, sorry, did you say 800 with regards to I guess allowing them to be rent free? Did you say 800 and something a week?
Correct.
So my understanding of the program was that there would be no, at least initially, they wouldn't really be using our kitchens for cooking on site. It would be prepared in Kingston and brought out in refrigerated vehicles, and where our sharing center staff would help, I guess, distribute it and advertise it and promote it. So initially what I was under the understanding was that they were basically just looking for the storage of, like, I think there's 3 refrigerators. There's the one which is in the bar area, and then the kitchen itself, which has 2 fridges, I think. So that was my understanding, that they were just looking at this point just for basically the use of the fridges, not cooking in our kitchen or anything. But maybe that's changed. That was a few days ago.
Lori?
Through you, Mr. Mayor, the information that I have is they would be storing their food in our kitchens. They wouldn't be cooking them. They would need tables set up inside the community hall itself to have the food ready to go out. And then it would be a drive-through program that comes through the back and the side of our parking lot, as they would be handing it out outside. So that whole facility would be utilized for the full 3 days of the week. Now, those facilities are currently closed and we are not receiving any rental fees right now at all. But if they were open, those are the rental fees based on like full days. So it would be 3 full days because of the amount of space that they would be needing. As I said, right now they're closed and we are not collecting any revenue for those areas. It's 8 volunteers that they need to run the program. I believe the volunteers from the sharing center are probably involved, but I currently at this point don't know the names of the volunteers. I know that they work in close contact. They're working in close contact with the health inspector, and they have vetted their process through them, and the self-screening and all of those things are being taken care of. But in terms of the amount of space they need, that's what they would need, the parking lots, the center itself, and then the fridges for the storage.
Okay, Councillor Park, or Councillor Gordon,
Pardon?
does that answer
Yeah,
your
no,
question?
that's fine. That's fine.
Okay.
That's fine.
Thank you. Are there any other questions with regard to, I'll start with regard to Lionheart. Seeing none, are there any other questions with regard to the special events report that's before us? Seeing none. Okay, let's go to motions. The report before us has a recommendation with an or, either 1 or 2. Councillor Townend, go ahead.
I would motion to receive the report and adopt recommendation number 2.
Good. Number 2, seconded by Councillor Buderick. Councillor Townend, you wish to comment? Go ahead.
Yeah, I think a lot of number 1 is kind of implicit in number 2, in the sense that we're unlikely to do anything rogue in Loyalist Township that's not in congruence with what the higher levels of government are doing. But the way number 2 is worded is it does give us a sense in which we will address local concerns locally, which seems to be currently under the advice of our regional public health authority, kind of the trend of how this is going to look going forward. There are going to be lots of local approaches, so this makes sure that we have our finger on the pulse about how how we want to approach these things in Loyalist.
Thank you. Councillor Buderick, we should make comment.
Those were my thoughts as well, actually. Yes, thank you.
Okay, thank you. Any other comments on the motion before us with regard to special events? Okay. I make note the section in the report that speaks to the Bath Canada Day event and the unfortunate circumstance that will be either canceled or significantly changed because we can't have that kind of gathering right now. So with that, unless there's further comment, I'll call the question. All those in favor? Any opposed? Motion is carried. Right, so that's a special events motion. Right? Do I have a motion with regard to Lionheart? The director is looking for the approval of the program, the waiver of the fees, and a timeline to extend that offer to that organization. Councillor Townend.
So moved.
And so moved to go ahead, waive the fees, and do it until, give me a date, or give me a suggestion.
Well, I agreed with the director's approach to a month-by-month basis.
Fair enough.
So let's say June 1st for now, just to pick an arbitrary date.
And or we can actually include in that motion on a month-by-month basis
Sure.
to be ratified later.
Sure.
Is the clerk okay with that motion? Thank you. Does that satisfy the director's need for direction? Yes, thank you. Thank you, Councillor Townend. Do I have a seconder for that? Councillor Gordon. Mover, any comment?
That's probably the shortest motion I've ever done.
Seconder, do you have any comment? Councillor Gordon.
Yeah, I just would add to the program being, it's right up in the wage standard about it. It's certainly helping a lot of people. It's great that they're willing to come out to Loyalist Township. And I would tip my hat to the workers at the Sharing Center who are already doing a tremendous job and now are prepared to do even more. So I want to thank them for that. So
thank you. Do I have any other comments with regards to this? Seeing none, I'll call the question. All those in favor? Any opposed? None. Motion is carried. Thank you. And moving forward, I think that's all for community and customer services right now.
Oh,
And,
one more.
One more? Oh, yes. Item 12.4. The Loyalist Community Sharing Center Agreement Renewal. We have a report before us from Ms. Shamahorn with several parts. Are there questions for the director with regards to this report? Being none, does the director have anything to add to the message at the time?
Not at this time, Your
No.
Honor.
Okay, then I would look for a motion. Anyone? Councillor Townend? So moved by Councillor Townend, seconded by Councillor Porter. Right. Right. Any comments?
No.
No, seconder, no. Anyone else? Okay, I'll call the question. All those in favor? Any opposed? Seeing none, motion is carried. Thank you. Now we move on. Okay. So section 13, corporate services, the departmental response from the township clerk. We have a report from the clerk. Okay. Okay. Again, you've all had it. Does the clerk have anything to add to it at this time? Okay, thank you. Are there any questions with regard to this particular report? None? Okay. And the recommendation is to receive for information and that we support continuing the extension for the discounted dog tag rate. Okay. Do I have a motion to that effect? Councillor Budrick. Do I have a seconder? Councillor Porter. Councillor Budrick, did you want to speak to it?
Nope.
Councillor Porter?
No.
And anyone else? Seeing none, I'll call the question. All those in favor? Any opposed? Motion is carried. Item 13.2, a request to install markers in the Lutheran Union Cemetery. We have a report from Ms. Teeple before us, and again, it has recommendations with an or. Right? Does the clerk have anything to add to this at this time? Thank you. And are there any questions with regard to the report? Seeing none, I look for a motion. Councillor Porter, seconded by Councillor Parks.
Yes, I'll move to receive the report and recommend that item number 2 be adopted.
So 1 and 2. And Councillor Parks, you're seconding that?
1 and 2.
Okay. And
Just for clarification, 1 and 2.
Yes.
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 Okay. Mover, did you have comment?
No.
Seconder, did you have comment?
I just wanted to say I think this is a great program and it certainly honors our veterans.
Absolutely. Okay. Is there any other comments from council? Seeing none, I'll call the question. All those in favor? Any opposed? Motion is carried. We move to Economic Growth and Community Development Services Department. We have a report from Director Merritt, and I'm assuming Director Merritt is available for a comment or question. And there she is. And welcome, Director Merritt. Right. Do you have anything to add to your report at this time?
No, Your Worship.
Thank you. Council, do we have any questions with regard to the report from Director Merritt at this time? None. Right. Can I get a motion to receive for information? Councillor Budrick, seconded by Deputy Mayor. Councillor Budrick, any comments? Deputy Mayor, any comments?
No.
Thank you. Anyone else?
No.
Seeing none, I'll call the question. All those in favor? Any opposed? Motion is carried. And is that the only report for you? Okay, we move to emergency services. Okay. And again, we have a report from the chief with regard to responses to COVID-19, and the chief is available for questions or comment. As he's slowly coming into the system, I will ask if there's any questions for the chief at this time. And I'll go to Councillor Townend.
Yes, good evening, Chief. Could you reassure Amherst Island residents that recent changes to Amherst Island's tiered response protocol do not place residents in any greater risk during a medical emergency, and that they can expect the same quality of medical assistance when they need it?
Through you, Mr. Mayor, to Councillor Townend, the downgraded response still includes ambulances greater than 30 minutes, which in most instances, I gotta move my camera. Most instances will require the Amherst Island crew to be dispatched. Changes were on the recommendation of the medical officer of health. So mostly beyond our control. Response level is set by the Ministry of Health, and any life-threatening condition will still require a fire department response. I don't think you'll see many changes. If someone falls down and twists an ankle or something, you probably will not get a fire department response. But if it's a life-threatening condition, the fire crew will still be dispatched.
Thank you.
Okay. Any other questions for the chief at this time? Seeing none, Chief, did you, oh, sorry, Councillor Buderick, go ahead.
Just a comment on great daily updates that we're receiving. Thank you very much. Doing a fantastic job there.
Good. Chief, did you have anything to add to your report at this time?
Not at this time, Mr. Mayor.
Okay, then can I get a motion to receive the chief's report for information? Moved by Deputy Mayor, seconded by Councillor Parks. Deputy, any comment?
Not specifically on this, just thanks to the department for everything they've done through the whole situation. And it seems like when something needs to be done, a lot of it does get bounced off of them. So they're very busy. Just well, it's appreciated.
Absolutely. Councillor Parks, you were seconder. Do you have any further comment? Okay. Anyone else? I'll call the question. All those in favor? Any opposed? Motion is carried. And again, our greatest thanks to the Emergency Services Department as a whole. Thank you. Next up, item 15.2. Again, a report from the chief with regard to municipal support to residents impacted by flooding. We have a report before us. I believe this was requested. Chief, did you have anything to add to it at this time?
The only thing that I would like to add, Mr. Mayor, is that the forecast for Lake Ontario is looking a little bit more favorable basically every day. I think we'll still see some limited shoreline flooding in a high wind event, but by the predictions now, if they hold true, we should be well below our 2019 levels. So
good to know. Thank you. Any other questions? Any questions with regard to this report? Seeing none, can I get a motion to receive for information? And Councillor Parks, seconded by Councillor Townend. Councillor Parks, any comment? No.
Just wanted to say thank you.
Okay. Councillor Townend, any comment? And anyone else? Seeing none, I'll call the question. All those in favor? Any opposed? Motion is carried. Thank you. And item 15.3, the open air burning bylaw. Chief, did you have any comments to make before we send to council? Council, do you have any questions with regard to this? Councillor Porter, go ahead.
Oops. Sorry. The previous bylaw did not require agricultural or farmers to get a permit to do their brush burning. In this new bylaw, the way I'm reading it, you're saying that they now do need a permit. Can you clarify that, please?
Through you, Mr. Mayor, to Councillor Porter. For the last number of years, when a farmer has been burning or someone's been burning in brush, we've always received phone calls. They usually advise us they're going to burn. We've just never formally requested they do it. But based on some of the new liability requirements, someone telling us that they're burning 100 feet from a barn and we have no way of ensuring they're following the guidelines. So the permit gives us the ability to speak to it, email it to them. They can come and pick it up or whatever. So it's just a way of ensuring that they are following the proper guidelines. And if it gets out of control, there is no fee for it. We're not going to charge for it. We're just asking them to call in. And I don't think we probably have 30 or 40 farmers that burn pretty well continuously, and they're very smart about doing it, and they call all the time anyway. So it'll just be a bit more of a formal procedure where we'll be documenting it, and we're going to try to limit the responses through our dispatch by making sure they have a known address. So if we get a complaint, someone will drive out, but it will hopefully save the dispatch of a full crew.
So you're saying that there will be this permit is going to involve no actual fill out paperwork and application form. It's going to be basically in the form of a telephone call. Is that what you're saying?
Through you, Mr. Mayor, to Councillor Porter. Yes, at this point in time, we're going to do it just by a phone call. We are going to play around with an online version, but they will be able to do it either way.
And can I also ask, have you had a lot of issues in the past with farms and their burning of their brush? Is that why you've included it in this bylaw for them to have to get a permit now?
Through you, Mr. Mayor, the biggest issue we have with farmers burning is we get complaints from the OPP because their smoke is blowing across a roadway and causing a concern to traffic. And as soon as that happens, then it becomes our issue to go and deal with it. So if we can ensure that they take into consideration wind direction and they're far enough back from the road, items like that, it might help alleviate some of the problems we get.
And just one last one, then will they be able to call this in on the weekends?
Through you, Mr. Mayor, yes, we're going to make sure that the on-call chief, the phone number will be directed to the on-call chief's cell phone. So if they decide they want to do it on the weekend, they can call it in.
And one last comment or question is that the intent when we reconsidered this bylaw, it was to loosen some restrictions and make for more clarity as for residents to have small campfires, especially in the rural areas. I don't believe the intent of council was to ever add additional regulations or restrictions to our farming community.
That's just a comment, or is there a question?
Order.
That's fine. All right. Are there any other questions for the chief with regard to this bylaw? Seeing no hands, and I will look for a motion. Any? Councillor Townend, and seconded by Councillor Parks. Councillor Townend, do you have comment? Councillor Parks, do you have comment?
Yes, through you, your worship. Just, I think it's good to have a little bit more of a formal process for it. I understand it can be an inconvenience and a bit of a setback maybe for some of the agricultural areas, but I think for safety reasons, it's probably worthwhile doing it.
Thank you. And any other comments? Councillor Porter.
Yeah, no, I'm in agreement with the motion and I am going to support it. It only because I think it's going to alleviate any false calls and any responses that weren't actually necessary if you have that information ahead of time. I'm not in favor of increasing requirements, paperwork, and regulations. So as long as we can be assured that it is a matter of a phone call, that it's not going to morph into paperwork and applications and fees later on, then I can be satisfied with that.
Thank you. Other comments? None. All right. Back to the mover for last comment. Nothing. I'll call the question. All those in favor? Any opposed? Motion is carried.
Just to follow up,
Okay.
Mr. Worship, if I may.
Go ahead, Councillor Porter.
That response from the fire chief is going to be included. Can that be included in writing somewhere, please? So that there's a historical record.
And I'll turn to the clerk. And I believe the Councillor Porter is looking for a recorded statement from the chief indicating that a phone call and a weekend availability of the permitting process is available.
And no permit fees.
Through your worship, the permit fees would be included in the bylaw, which I don't believe is in there
That's fine.
now. And in regards to the other, we normally wouldn't include comment, but I can make a note in regards to those two items.
No, thank you, because if Chief Stevenson retires or doesn't remember or something, we want to have a record of that somewhere.
Ultimately, without a fee in the bylaw, there can be no bylaw, and there can be no fee until such time as council would approve a bylaw. So at least that part would certainly be covered. The program for it to be covered over the weekend and by phone, again, that's the intent, and I'm sure the chief will see it roll out. But your comments are noted.
Thank you.
Did I call the question? Not yet. Okay. Oh,
Yes, you did.
and the clerk says I did.
You did, you did.
Then we can move forward to communication for consideration, notice. Oh, are there any notices of motion or direct motions? Seeing none, we move to the consent agenda. And for the purpose of convenience and for expediting meetings, matters of business that are repetitive or routine in nature are included in the consent agenda, and all such matters of business are contained in the consent agenda are voted on collectively. And a particular matter of business may be singled out from the consent agenda for debate or for a separate vote upon the request of any member of council. In the case of a separated vote, the excluded matter is severed from the consent agenda. Each and every matter in the business contained in the consent agenda is recorded separately in the minutes. Right? One moment. Thank you. I was getting a significant echo here. So we have the consent agenda before us. Is there anything from council that you wish to separate out? Seeing none, can I get a motion for the consent agenda? Councillor Porter, seconded by Deputy Mayor. Okay. Any comments? I'll call the question. All those in favor? Any opposed? Motion is carried. Scrolling down. Where are we? There are no consent agendas extracted, so we move to members' privilege. Right. Is there anything under members' privilege that any member of council wishes to bring forward at this time? No one? All right. Then we move forward to upcoming meeting dates. Right. We have the clerk has commented that we need to schedule electronic meetings for council and for committee of adjustment to be discussed. Right. I believe the intent is for council meetings to continue on basically their regular schedule through this virtual format. The committee of adjustment is a little more difficult, although we do have clarity, as I understand it from the clerk and from the planning department, that we can continue to have the committee of adjustment meetings. The difficulty is, of course, committee of adjustment is typically a public meeting where people's comments are requested on a per item basis. That is a difficulty to arrange under the current electronic communication processes, but it is the intent that we need to continue to do those. As far as the discussion, is there anyone that wishes to make a suggestion or comment with regard to a schedule other than our standard schedule? So we're all good with that? Thank you. And to the clerk, right, is there anything else that we needed to discuss on the schedule?
In regards to the Committee of Adjustment, they'll be extending the notice time. So we'll come out with protocols, written protocols on that, send that out to council, and then be able to schedule the first meeting date and let council know.
Thank you very much. Right. So that covers our schedule for the upcoming meetings. Right. We move to the confirmatory bylaw. Can I get a motion for the confirmatory bylaw? Deputy, seconded by Councillor Porter. Right. I'll call the question. All those in favor? Any opposed? Motion is carried. It brings us to adjournment. Can I get a motion to adjourn? Councillor Buderick, seconded by Councillor Townend. Right. Call the question. All those in favor? Any opposed? Motion carried. We are adjourned, folks. Thank you very much for attending this evening to our audience. And well, hopefully we get better at this as time goes on. Take care all, and
Thank
have a
you.
good week.
Bye.
Bye.